Welcome to Prime Life. We call it Retirement 2.0. Leave each episode with tips and new ideas to help you navigate retirement in our new age. It's your time. Make it count.
This podcast is for educational purposes only. It is not intended as medical, investment, or financial advice. We do not sponsor or endorse any of the individuals, companies, products, or services featured on this podcast. Any statements or opinions expressed are of the individual who makes them. We hope you enjoy the episode.
Hello, everyone, and welcome to another episode of the Prime Life Podcast. This is Josef Katz, and I'm here once again with one of my favorite people, Mary Crean. How you doing today, Mary?
I'm doing great, and I know you're not just saying that, are you?
No, of course not.
That I'm one of your favorite people. Okay, I just want to make sure about that.
So I know we have a great show lined up today. If you'd be so kind as do an intro of our guest, and we can jump right in.
I will. So our guest, actually, he and I met before. I am a patient of Dr. Brook Seeley. He is a double board certified physician and surgeon specializing in plastic facial surgery of the aging face and rhinoplasty, as well as medical weight management and wellness. And before I have Dr. Seeley talk about himself, my primary care physician referred me to Dr. Seeley. And it was a great introduction for me. It's always good to know, like, and trust someone that we work from a medical perspective. Dr. Seeley, welcome to the Prime Life Podcast. It's great to have you here. Tell our audience a little bit about yourself.
Hi, Mary, and hi, Joseph. Thank you so much for having me. This is a nice little treat, a little something different today. So this is great. So very happy to have met you and happy to be invited on the podcast. As you mentioned, my specialty is facial plastic surgery. So it's a little bit of a unique specialty in the field of medicine. The path was basically, as most physicians, you go to college and then medical school. So I went to Dartmouth College and then the University of Rochester Medical School. And then when you go off into your subspecialty training, whatever you choose, you do residencies and fellowships. And I did my residency at the Cleveland Clinic, which was head and neck surgery, and people will commonly refer to as ENT, otolaryngology. And then in terms of a subspecialty within that facial plastic surgery, I went to the University of California at San Francisco. So that was kind of the training path. And then after that, I had grown up in upstate New York, my wife on Long Island, and we always wanted to be in New England. So we kind of hunted around and found the Hartford area, and we set up practice here in 2002 at Connecticut Facial Plastic Surgery.
That's quite the journey. You've crisscrossed the country, so that's awesome.
A little bit of a roundabout, but now we're here to stay. So,
and you kept getting more refined, head and neck, face, So I guess let's start with this idea of anti-aging. It's a big topic. Maybe you can talk about why people would come to you for those sorts of solutions, shall we say.
So, I mean, when you touch on anti-aging and wellness specifically, that's a really new field in medicine. I mean, when you look at medicine as a whole, and everybody's familiar with your basic specialties, and when you're in medical school, you might want to train in pediatrics or orthopedics or so on. And there really has never been a specialty of anti-aging or wellness medicine. It's been something that's kind of a more recent development. So different people from different backgrounds have gotten into it. Our path to get into it is we were in the facial plastic surgery business for decades now, and the vast majority of our patients are kind of themselves in that space. They're at the stage of life where they're feeling good and looking good, and they want to kind of maintain that and kind of extend how long they look good, but kind of along with that is how long you feel good, because it doesn't do any good to look great and not have great health. So it makes great sense, I think, for someone in our world to get more involved with, okay, we want to make the patients, they will come to us saying, we want to look as good as we can on the outside as we feel on the inside. And we have a vested interest in making sure they feel good on the inside as well, because that's going to make them look good on the outside. So if they look good, we look good. So it's a good interchange.
Well, I love that. But I'm also interested in learning, and I know our audience is, how do you advise patients who can be a bit overwhelmed with all of the anti-aging solutions and products out there that tout, I should say, the ability to take years off your face, for example?
Our focus has always been the face. So, and if you go into virtually any store or start clicking around on your internet, there are a million and one products that are going to pop up with amazing promises of, since the beginning of time, and Ponce de Leon and all these people, the fountain of youth, it's been there for a long time. No one's ever actually really found it. But I would say that the biggest issue we find is that there are so many claims that are unsubstantiated. So if you create a cream, and you could create Mary's cream and Joseph's creams and Brook's creams, and we could put them all out there on the market, and we can say all sorts of outlandish things about what they do, and you can kind of get away with it. And then the concern is, how do I, as the consumer, filter through that? So I usually tell my patients, number one is keep it simple. I mean, if people are promising you things, that do things that don't make any sense, that they would really put a cream on and they show it before and after, and it looks like the person's lost 30 years. Don't believe that. That's not real. That's Photoshop. That's all sorts of different things. So if it sounds too good to be true, it is. And no one's going to go out and just do everything. So try to focus on, there's a saying of majoring in the majors, find the most important things to focus on. So whether that's skincare, whether that's procedures, and we can kind of get into the different building blocks, for skincare in particular, patients can just sort of figure out, okay, these are the things I want to address. I don't like how blotchy my skin looks, or I don't like these wrinkles over here or these folds over there. My eyes look tired. We're not going to go after everything with 5 million different hammers or 5 different nails. We're going to try to find the big things that are going to make the biggest difference and go after them. And I think if you keep it simple and you get a good skincare line and you have a provider that you can work with and come and focus your plan on the most important things, you're going to make a lot of headway rather than drowning in all of the many different options that don't really do very much. So I tend to recommend getting the right person involved and kind of focusing on the most important details.
I'm glad you brought up the hammer and nail analogy because I think you're the first plastic surgeon we've had on the show. So you hear surgeon, you automatically say, oh, surgeons like to do surgery, right? Hammer and nail.
Sure. Yeah.
Is surgery going to be the first thing you recommend to people if they walk in the office because that's what you sell? Or are you going to try to find a solution that may be more holistic, or, show them a variety of options as opposed to just surgery alone?
And we'll get that answer after a brief word from our commercial sponsors.
NASA is always working harder to be your carrier of choice. We offer insurance products that can help you meet your retirement goals, such as protecting your savings, securing lifetime income, or paying for healthcare costs. We're dedicated to providing best-in-class service and are keeping things simple, and we'll have your back. We have around 400,000 policyholders and contract holders and have been doing this for a long time, 170 years, but we remain humble enough to always try to improve. For more information, visit nfg.com. Nassau insurance products are issued by Nassau Life and Annuity Company of Hartford, Connecticut, Nassau Life Insurance Company, East Greenbush, New York, or Nassau Life Insurance Company of Kansas, Overland Park, Kansas. Subsidiaries of Nassau Financial Group. Products are not available in all areas. Policyholder counts are for all Nassau companies as of September 30th, 2022, and are subject to change.
So in some cases, it could be both. So some people are going to come in with an obvious surgical problem, like maybe somebody who has they've broken their nose and it's off to the side, or maybe they just have this hump on their nose that they don't like and they've had that forever, or someone who comes in and they are 65 and their jowls are pretty obvious. And I can look at that and say, we're not going to do much with that with cream or, with a laser or something like that. And so in those cases, we may say, let's kind of make the biggest impact we can right away by going to surgery. More often, I would say patients come in with a litany of complaints, and we're not going to, like I said, do all of them at once. So we will oftentimes say, okay, let's start with the things we can do. Maybe, like I said, skincare, you can do that at home. So we can kind of guide you through the process, get you into the right products. You can do this at home. We'll follow along with you. The things that clear up, that's fantastic. The things that don't, okay, then we're going to work into, a laser or a chemical peel. And then, along the way, of course, there may be times where they say, look, I'm fed up with this and I want to just go ahead and have a facelift. And then, of course, we're there for that as well. So we can kind of go at the pace of the patient. And some patients have more boxes already checked off when they come in to see us. They've been doing skincare for 20 years and, we don't need to guide them as much. And other people have come in and they've never done anything but rinse with water and a face cloth and go to bed. So there are some things we have to kind of sift through.
I think that's an interesting point that you make, right? Because I think some of us may assume, well, someone's already been going through a skincare regime and now what's next? But I would love for you to explain the difference, if you wouldn't mind, between chemical peels, lasers, and radio frequency treatments. And I have to admit, radio frequency treatments, I have never heard that. And I would love to learn a little bit more.
In terms of things that you can do, we're now focusing on, let's say, the skin. So not so much the, coming with like a turkey waddle or the deep neck folds or something like that, which might be more of a surgical indication. But people come in and they want to make their skin just look better, whether it's fine lines and wrinkles or sunspots or old acne scars or different things. People have different indications. So the big sort of buckets, if you will, skincare are things you can do at home. FDA, we only use FDA approved, kind of regulated. The beauty of working with FDA stuff is they have gone through the studies and the tests that show, first of all, it's safe. Second of all, it's effective. And generally speaking, it stood somewhat of the test of time. There are peer-reviewed studies that show that I am not just promoting something that I want to sell. We know this is going to work. So that's one group of things. And we can do a lot with just topicals. Kind of going up the ladder from that are chemical peels. Chemical peels are skincare that we do in the office typically, and they run the gamut from mild to moderate to more aggressive, deep peels. The mildest ones you might run into at more of a MedSpa setting where somebody is going to use a glycolic acid peel. It's an acid. It goes on your face, typically and neck. People do it on their hands and different things, and they are going to exfoliate some of the outer layers of the skin, get off some of that sun damage, help with dryness, make it feel and look better. And they do definitely serve a role. Those would be kind of similar to something like microdermabrasion, if you've heard that term, where it's almost like a minor little, people refer to it as sandblasting. That's a little bit aggressive, but you're kind of exfoliating in a more aggressive way. Usually that's done by an esthetician, maybe a nurse in a med spa. And those are really nice treatments for the skin, especially if you have like a wedding coming up or something like that. You just want to look your best, but they're not going to have long-term effects. Chemical peels, as you go into the more medium layers, they're going to start stimulating collagen production and elastin production and some of the things that are underneath your skin that give it its youthfulness. They're going to help your cells turn over and exfoliate better. They do have a little bit of recovery with them, but it's not bad. It's going to be a few days of redness and you'll be back to work. Deeper peels would be something like a phenol peel. Not too many people are doing those these days. They're effective, but they have to be done typically under a more medically guided setting in an operating room with an anesthesiologist. There are risks to your heart and stuff. So you have to be a little bit more focused on those. And I'd say they're not quite as popular. They also have a lot more downtime. Lasers kind of run the gamut similarly, where we can have a less aggressive laser, where a typical one would be like a CO2 laser. So carbon dioxide is what's in the laser, and you can tone it way down. So you have a light setting, and they call it a fractionated laser. So these columns of laser beams drop down onto the skin, and they create like little tiny cores within the skin. And based on how much energy they're emitting, you can make those cores very superficial or a little bit deeper, and they can be narrower or wider, so they can destroy more or less tissue. But the point is they are destroying tissue, they're vaporizing it, and then your skin heals within the area that was left behind. So it tightens your skin, and it helps with wrinkles, and it helps with your tone and your texture. And if you go, again, on the very light end, you might have no downtime, but that might be something that you would have to do 4 or 5, 6 times because you're not going to get that result, without the downtime. Versus you can kind of crank up the laser a little bit more intense, a little bit deeper. Maybe you have a 5 or 7 day downtime where you have to keep putting some ointments on your skin so that all those little holes heal. There's a little bit more redness for a while, but you get much more of an effect. We would tend to do that with older, more damaged skin, a lot more sun damage. Things like acne scars would require something like that. We do that to surgical scars or dog bites, things like that. So that kind of covers very roughly covers the peels and the lasers. And then the other one you mentioned is radio frequency. Radio frequency is a relatively newer technology. You may have, I don't know if you use brand names in the podcast or not, but there are different brand names.
Yeah, you can.
So people may have heard of Morpheus 8. That's a kind of if you read, Vogue magazine or these different things, you have these influencers, but a lot of different companies will use a radio frequency device. And what it looks like is a standalone device that kind of sits in the corner, and it has a handpiece. It almost looks like a little gun. And at the end, it's a square. Usually it could be round, but usually it can be a square. And these little pins come in. So you numb up the face for 45 minutes or so, then you wipe off the numbing medicine. And then the pins they go into the skin, a controlled depth. And you can set it 1 millimeter, 4 millimeters, depending on the thickness of the skin. You would obviously use different settings in the middle of your cheek that you might use on your eyelids or something like that. And when those pins are in, so if you just do that, that's called microneedling. So small little needles will go in and out, and then that creates a little wound and you heal from it. If while the pin is underneath the surface of the skin, it emits energy in the form of a radio frequency, that energy kind of goes from pin to pin and back out into the handpiece. And as it does, it heats up the skin at that mid-level or even on the deep level. And that will allow the deeper tissue to contract and tighten. So people will think of it as, and this is an aggressive term, but shrink wrapping. So it's kind of like tightening all over your skin. No one wants to look shrink wrapped, so I wouldn't like to use it quite like that. But it does tighten the skin kind of subtly and diffusely. And those things can be stacked. Like you can do a microneedling and at the same time do a laser. So the laser is going on the outside and the microneedling is going a little bit deeper. Or you can mix and match with chemical peels and stuff. So those are all sort of commonly used modalities in various strengths for skin rejuvenation.
I have a whole bunch of questions.
Yeah, feel free.
So let's see if we can knock a few of them out.
Yeah.
You're a surgeon, so you're not just dealing with the skin, you're dealing with muscle and bone, I assume, as well, right? In the facial
more
structure.
When we're doing surgery than, with lasers and stuff, yeah.
And where does the dermatological doctors end and surgeons pick up, or are they a lot of the times the same people? Like you guys are talking about lasers and the different needling and things. I think I have heard dermatologists doing that too. So
absolutely,
where's that difference? And then my last question is, skin ages, right? Maybe just talk a little bit about like what that progression looks like, or what people can do earlier versus waiting for this to happen.
Sure. So the first one, so there are many different groups of doctors and other practitioners, nurse practitioners, PAs, stuff that are doing these sorts of things depending on the setting you're in. And even the rules change from state to state. But in global terms, to answer your question, if you're talking about, so we're, for example, facial plastic surgeons, we don't do anything on the body, but there are general plastic surgeons that do head to toe. But if you're looking at plastic surgeons, we'll call it facial plastic surgeons versus dermatologists, different background, different training, they're going to focus pretty much exclusively on the skin. So the things I just mentioned, they will do those to the nines. They will do lots and lots, depending on if they're cosmetically oriented, but they will do a lot of peels and a lot of lasers. And that's really kind of the focus of what they might do if they're not doing things like medical dermatology, where they're doing, skin cancer or acne or psoriasis or all that stuff. But if they're focusing on cosmetics, they're going to be doing a lot of those. And some of them may have done special training in derm surgery, so they may get a little bit more aggressive with doing some of the things that we would consider more of a surgical procedure in terms of lifting procedures and eyelids and so on. But the focus of them is going to be on the skin. We're almost the opposite, where our training is more on the surgery and we would do some of the skin. So there's this gray area in between where we're both working. Our focus would be, what our day in, day out is a lot more going to be eyelid tucks called blepharoplasty, brow lifts, face lifts, neck lifts, that sort of thing. But, because that same patient who's getting their facelift is going to want their skin to look nice, we oftentimes have some overlap. And sometimes you'll actually find them working together. We have patients, I have dermatologists that I work with, and, they do this part and I do that part. Depends on the, where the patients are coming from and what they need. I'm sorry, there was a second part to your question.
Yeah, it was just about the aging, how skin ages and
how it ages. Yes. So some global things change. So if you look at the skin of a teenager, let's forget the acne part. A lot of teenagers are dealing with that. But let's say you've gotten through the acne part, a young person's skin versus, as they go through decades and decades of life, you're going to find that the structure of that skin changes. So one thing that changes is cells turn over. So if you think of your skin, if you were to look on a cross thickness, it looks like a brick wall, right? And the bottom bricks are newly formed, and they migrate from the deep surface to the superficial. And as they do, they tend to flatten out. They get thinner, and it's almost like an onion. The thick parts are thick, or the deep parts are thick, and the superficial parts are very thin and scaly. And then eventually they slough off, and that's where you get dry, flaky skin. So cells go from deep to superficial, and that rate of transition slows down with time. So that rate of transition in a 20-year-old versus in a 60-year-old, it's going to be much slower in the 60-year-old, and that allows more stuff to happen. So the slower it goes, the more it is subject to changes of UV radiation from the sun, hormonal changes from your body composition, all sorts of different things can happen. Also, things change, like your glands change, your oil-producing glands change, just like you might have acne at one stage of your life, you might have oily skin at another and dry skin at another. We also find that the composition, the collagen and the elastin and the things called glycosaminoglycans, the structure of your skin tends to get less organized by sun damage over time and break down and just become a bit more lax. So just as everybody sort of notices, their skin just loosens up a little bit, gets folds and wrinkles. That's how it presents visually. But what's going on underneath there is kind of a breakdown of a lot of that structure. And so when we're going into intervene and create, use lasers and use these chemical peels and use like Retin-A and all these things that people use, they're designed to reinstate some of that structure in the form of more collagen, more elastin, better cell turnover. The retinoids in particular, Retin-A, retinol, they help with that cell turnover. So virtually every skincare line is going to have some form of one of them, or they should, because they really, it's kind of a mainstay of the treatment to make it more youthful the way it behaves.
But the behavior of the cells are going to continue to age, right? So they're going to
so you're always going to be aging, hopefully, right? The alternative is a great one. So that's where we say, well, what can we do to protect that skin? So sunblock obviously is huge, or sun avoidance. Don't necessarily all have to become vampires, but you absolutely want to have good sunblock, because that ultraviolet out there it's not doing you any good. Some people it's doing more harm than others, depending on your genetics and what type of skin you have. But it's really not good for anyone other than adding, it helps you with your vitamin D, and a little bit is good, but too much is definitely not good. And you want to make sure you have good sun protection. Antioxidants in general help your body undo some of those free radicals and some of that damage. So that's where things like vitamin C, you'll see come in, vitamin E, ferulic acid, these different things that are in some of these skincare products, they are helping to kind of undo some of that sun damage. So they can be very helpful for that.
This is a really good segue into supplements versus topical treatments, or can you talk a little bit about that?
Yeah, sure. So, one of the big things we run into is the majority of what people are thinking of in terms of skincare is topical skincare. So, you go home with a cream or a lotion or an ointment or something you put on your skin. And some of them are fantastic. There are some things that people put on their skin that just aren't really absorbed by the skin. So, you put it on there and you think, oh, I'm doing this thing that's supposed to add moisture or supposed to get rid of blemishes and so on. And in reality, the way it's being used, it's just not really going to get the job done, or at least not to the extent that the marketing materials would lead you to believe. So you do have to be careful with those. But yes, we do use both topical treatments and supplements on the inside. So supplements that you can take in the form of, typically these things are either pills or powders, pills, little capsules that you take like you would take a vitamin, versus a powder that you might put into a drink, say your morning protein shake, or however you might like to do it, along with a lot of people getting into these greens and different things that you put in the morning. And so you can create your little stack of things. But some of them are really interesting. They're being combined now. We got some really new things. Actually, Mary might be interested in. There's a thing called sun powders.
I'm very interested in that, by the way.
Yeah. So I wish I came up with it. I had nothing to do with it, except for I actually literally heard about it on a podcast and said, wow, this sounds fantastic. And I did some more research into the guys who did it. But a couple of very bright guys that are dermatologists, a Harvard trained guy and a Stanford trained guy, and out in LA out there. And they're, immersed in the academic world of dermatology, but also they're immersed in the LA world. And they came up with these powders that you put in water, dissolve them, or put them in your coffee or your shake or whatever. And every day, and they've sort of basically taken a lot of the things that have science behind them. So research papers that have shown in a non-biased way that these are effective ingredients and put them together in one simple way. So, you've heard of some of these things: biotin, vitamin C, collagen. These are things that are going to help your skin behave better and be healthy. Hyaluronic acid, which adds moisture to it. But what's kind of interesting, there's a couple of, unique to this product. There's a thing called nicotinamide, which when they first released their studies, they did these large studies on people that were taking that nicotinamide every day, and they showed a quote unquote up to 30% decrease in non-melanoma skin cancers by taking a daily supplement. That study actually just literally this past week was updated with more people and more time and more data, and that number boosted to 54%. So if you took, 100 people and you gave them all these powders every day, you'd see a difference in how many of them might go on to get skin cancer later in life, which is huge because as people get one, then they're worried I'm going to get another one, because obviously if you had one, you've had some sort of genetic predisposition and or a lot of sun in your life or whatever it might be. But now you're kind of in the risk pool, right? You're going to see your dermatologist every 6 months or every 12 months, and they're doing this head-to-toe survey, and all that stuff is super important. But good sun protection on the outside is very important. Why not throw some sun protection on the inside? So we've been happy to kind of get our hands on that. And honestly, it's fairly benign stuff. It's relatively inexpensive. So it's kind of nice to have things like that coming along. Good people out there doing research.
No, that sounds good. Yeah, go ahead.
I just want to make sure I heard you correctly. So you're saying people that took this powder had a reduction in skin cancer?
Yeah, decreased rate of future skin cancers.
So people who had already had some form of a cancer.
Oh, they wouldn't necessarily have to have had it, but they looked at groups who took it and versus groups who didn't. The rate of skin cancer was lower in those who took it. And actually, one of the other interesting things that's in that same powder is, and I'm going to mess up the name, it's Polypodium leucotomos. It's not an easy one to remember. It's an herbal extract from the Amazon. And they found that these guys who were down in the Amazon, native Amazonians, would be out there going on these multiple day fishing trips. And they would eat these leaves before they would go out because they knew that it would protect them from getting sunburns. And so they did some research on that and found out what was in those, and that's what the compound is. So they put that in there. So if you take the product every day, it decreases your risk of sunburning. And even at people who have gone and gotten sun, it'll help kind of get rid of those brown spots faster. So patients often come to us and say, let's get rid of these brown spots, especially after the summer. They spent the day at the beach or the golf course or what have you, and they forgot to put on their sunblock or didn't reapply, and they got a bunch of brown freckles that they're not excited about. You can laser those for sure, and you can use topical hydroquinone, and that's, we do all that stuff, and chemical peels work great. But why not take a daily treatment that helps minimize it as well? So those are some new options we have.
You also mentioned collagen. So I know there's a lot of people think it's, made up. People think it helps. Like, is there any scientific data one way or the other with ingesting collagen?
It is a good question, and I'd say there's mixed data on it. So it's not one of those things like retin-A where we can say definitively, we know science after science, like experiment after experiment, this is absolutely should be like dogma, that everybody should probably be on a retinoid. Collagen, a couple things. One is it's a very big molecule. So it's in your skin, it's in your hair, it's in your fingernails, your joints, and everything. If you put it topically on your skin, it's generally speaking too big to get absorbed. So if you buy a skincare product with collagen on it, probably it's not really doing anything, to be honest. And then you think, oh, how about ingesting it? And the most studied and the most sort of consistently shown to be effective, although even them, there's still mixed data on it, are the collagen peptides. And so those are like the building blocks of the collagen. So the thought is that you're going to be consuming those. Your body is going to, and they come with vitamin C because vitamin C is necessary to take a peptide and turn it into the bigger structure of collagen. So typically those are taken together. So if you buy a good collagen peptide, sort of reputable brand, that's probably going to have vitamin C in it. And I think no studies have shown it to be harmful that I've ever seen, unless you have an allergy or something. Some studies have suggested that it's really not doing a lot, and several studies have shown that it's pretty effective. So I would say, if you can do it, I would recommend it. I take it every day myself. I do think it is useful, but it's a little hard to recommend it as absolute dogma at this point.
Mm-hmm. Yeah, I remember when I came to see you, I did remember that you said that you took collagen. That was like one of the takeaways. Of course, I said to Dr. Seeley, look at his skin, right? It's amazing. So, Dr. Seeley, we're getting kind of near the end of our conversation. Before I ask the final question, individuals are out there. There's a lot of information. There are a lot of different types of doctors with different certifications. What should an individual look for?
So some of this comes to your comfort level. I mean, as with anything, there's going to be people, and the example I'll give patients is some people want to have their baby at home. Some people want to have a midwife, and some people want to have the high-risk OBGYN, and they want to have their baby at Mass General. And, there's everything in between. So it sort of depends on you. But I'm a doctor. I mean, I'm a little bit biased that I think we've gone through a lot of training to do what we do. And so for most of what I do, I tend to recommend, just do your homework and make sure that it's commensurate. What you're getting is what you're wanting. But, there are doctors that get into this business because they start in another business and they get a little bit disgruntled and they shift over. There are people who have 20 years of experience and are board certified and have thousands of happy patients. And so, I tend to recommend look for somebody who has gone through an accredited training program, is board certified in the specialty you want, whether that is a dermatologist or a facial plastic surgeon. There are differences between those types of programs, as well as general plastic surgeons, as well as ophthalmologists and maxillofacial dental surgeons. There's a whole bunch of different training programs. So I tend to say, make sure they have the paperwork, if you will, that they've gone somewhere reputable, board certified, and that they've got years of experience. I mean, everybody comes out and needs to train a little bit when they come out, that, they're new. I've been there. We've all been there. But realistically, am I a better doctor now than I was 20 years ago? I think that we all are, right? If you do something enough, you're going to be better. So if it was my face, I'm going to go to somebody who has, a few patients behind them saying that they've done a good job for, decades.
I love that. So our last question that we had to ask all of our guests is simply this. You could probably do whatever else you want. You're very successful in your field, but why do you wake up every day and do what you do?
The simple answer to that is I just love it. It's funny. We have a good family friend who was an older doctor when I was going into thinking about applying to medical school. And I sat down with him at his house and just said, would you do it again? And he said, it's not for everyone. It's very hard. It's a long training. But, the quote was, if you love it, there is nothing better. That's, I think, has always been the answer. I love it. I love the patients that we get to see every day. We meet people from all walks of life, men, women, kids. We meet homeless people. We meet CEOs of major companies and movie stars and just everything in between. So it's kind of an interesting day, to be perfectly honest. I work with wonderful, caring nurses. My team here at the office is just great. They're, like sisters. I get to work with my wife. So it's really just been a really great time. My business partners are all wonderful doctors as well. So I just like what I do. Within the specialty, facial plastic surgery is a really interesting blend of science and artistry. So, we all have a face and we only have one. And so people come in and they are stressed out that, this is the problem and it is the center of their world. So there's a kind of an acuity to it, but it's also not usually life and death. So while we do take those sorts of calls, sometimes it's not quite as, straining all the time. So it's got a little mix of everything. And that's what I really like about it.
So my final question, what would you do with this face? I'm just kidding. Just kidding. Thank you so much for your time. I feel like we got like a year's worth of medical knowledge in half hour, 40 minutes here.
Before you go on to that, sorry, I'm going to interrupt you because I want Dr. Seeley to have an opportunity before we close out the show. Can you share some key takeaways for our audience, like maybe three things that they should consider about what we discussed today?
Yeah. So I guess in a nutshell, one is keeping it simple. So there's this like KISS, keep it simple, stupid. I was taught that in medical school. So if you have 1,000,001 different things you can do, you're not going to do them all. It's not like I want to lose weight, I'm going to go to the gym and lift every single weight in the gym or use every possible machine and do every exercise. You gotta have to kind of develop some priorities. So in my world, that starts on the inside. So let's get healthy on the inside first. You're going to look better outside if you feel good inside. So that's, get control of your diet, get control of your exercise regimen, get good sleep, try to control what you can control, sun exposure, stress, avoiding smoking and excessive alcohol, things like that. All of those things can help all of us, right? So every person in this listening to this podcast is going to do better physically if those things are in check than if they're not. So I think those are, without coming to the doctor, you can do those. When you come to the doctor, of course, we can help you with those as well. So keeping it simple, developing a good priority list so that you come in. I give patients a magic wand. It's a long Q-tip. And say, if you could change some things, what can we change? Let's focus this a little bit. So that's one. Do your homework. Like we mentioned, the doctors and the providers. There are people out there that are a little less honorable than others. There are people that are a little less experienced than others. There are people that are in the field for the wrong reasons than others. So, look at who you're selecting. If you need a second opinion, get a second opinion. If it doesn't feel good, don't do it. If you don't feel like this is the right person for you, that's not a you problem. It's just a match problem. They might be a great doctor. You might be a great person. It may not be a good match. So don't hesitate to come to someone for another opinion. If you find out the second person, you don't like them and you want to go back to the first one, they'll be honored that you came back. So do what's best for you in that regard, I would say.
Those are all good ideas and good suggestions. So thank you for that. Mm-hmm. I was just about to ask you what the best way for someone to get in touch with you if they want to have a consultation with you or make an appointment with your practice. What would be the best way to get in touch? And Mary has all your information. She'll put that in the show notes, of course. But what's the best way?
Yeah. So the best way is probably, the simplest way can be by the phone. You can always go on the website and find all sorts of stuff, and Mary's going to have that. But the telephone at our Connecticut facial plastic surgery office here in Farmington, Connecticut is 860-676-2473. And that's typical business hours, Monday through Friday. We actually tend to come in a little bit early. We start seeing patients at 7, phones go on at 8, and we cut out at about 4. So typically you can reach us that way. And then, of course, online, there's the website.
Amazing. Well, I do appreciate you sharing your wisdom with us today. It was very informative and lots to think about. So thank you. To all of our listeners, thanks for joining us once again. Tune in next week for another interesting, amazing Prime Life podcast episode. I'm sure it'll be great, Mary.
I'm sure it will be.
Until then, have a great week. And if you so inclined, give us a star, a like, a heart, whatever platform you're on, and we appreciate it. Thanks again. Have a great day.
Thank you.
Thank you.
Remember to subscribe to the Prime Life podcast anywhere you find podcasts. You can find all of our episodes, contact information, and more on our website, primelifepodcast.com. Stay connected with us. Follow us on LinkedIn, Instagram, Facebook, and TikTok.